Hi, so welcome to everyone joining us. I'm Helen Santini from the Huntington's Disease Association, and I've got Professor Sarah Tabrizi with me here, who I'll hand over to in a minute. But this is one of the first of two webinars that we're running, looking at how the Huntington's Disease Service at University College London can offer services to people who may not have access to local services. So just to mention, if you do want to pop in ask any questions, please feel free to pop them in the chat or in the Q&A. And you can also, if you want to do that anonymously, you can also pop them in the chat to the panelists, and we can hopefully answer those at the end. So I will hand over to Sarah to introduce herself.
Thanks, Helen, and thanks for asking me to do this. And I think, just so people know, the plan is that we'll put the webinar on the HD Association website, and we'll share it through YouTube, and people can listen to it whenever they like, and so you can tell people about it if they want. So this is really about, since not many good things came out of COVID, but one good thing that came out of it was that we were able to set up very much a virtual clinical service where we can do video appointments to people who want them all over the country. And so that's really been something new that we can offer. And this has given rise to this webinar. So what can we offer young people affected by Huntington's disease? And so I believe there's a huge gap in Huntington's clinical care for young people impacted by the disease, whether they're at risk, whether they've tested negative, whether they've tested positive, but are a very long way from developing symptoms, or whether they're actually just carers of loved ones impacted by Huntington's disease. And I think that young people have a particular need, and I think we need to bridge this gap to reach our mutual goal that we want of developing preventative disease modifying therapies for Huntington's disease. So I'm going to start by talking about the history, really, of what we know about Huntington's disease. And before I go into what a multidisciplinary team is, I'm just going to look back about how Huntington's has been treated historically. So this is George Huntington in 1872, while he was actually only 21 years old. So he was a young person. He first described Huntington's disease as a disease of the nervous system. And historically, subjects have been seen by doctors who diagnose and treat the disease. And historically, it's really been neurologists. With the birth of genetics in the 20th century, came a new specialty in medicine, and the discovery of the Huntington gene in 1993. And that led to genetic testing. And so some clinics are run by geneticists who do genetic testing. But we know that Huntington's is it's complex. It's genetics, it's neurological symptoms, it's behavioral symptoms, it's thinking symptoms, and it's also the impact on young people and families. And so it means that we now know that kind of psychological and psychiatric support and social support is really important for patients and families and young people impacted by Huntington's disease in any way. So the clinic that we run is a multidisciplinary clinic, and we have regular appointments if people want them. There's the opportunity to have a head-to-toe assessment if you want. We also have support with social issues. It's always possible to get in touch by email, and the service email is here. It's on the end slide as well. And you'll always hear about the latest news about Huntington's disease. So these are all the people who work in our team, who are part of the HD MDT team at UCL and at the National Hospital. And so what do we offer? We offer genetic counselling, and that can be done by video at any time. We do predictive testing for people at risk, and we do diagnostic testing for people after symptom onset. And genetic counselling involves typically an initial visit and then a cooling off period of 3 months, and then a second visit and blood test. And the initial visit is to discuss why you potentially want to be tested or not, the pros and cons for you as a person, and lots of things to think about, and you're able to go away and have as long as you want to think about it. Then you could, if you want to come back, have a second visit and a blood test, and you're followed up with the result 2 weeks later and then followed up thereafter. And genetic counselling, there's many reasons people seek genetic testing. It's often for reproductive reasons. It's often because they want to know more about the future. It's often because in the future, it does give you the opportunity to have prenatal testing, pre-implantation genetic diagnosis, which is with IVF, gamete donation, which is where you get donations of eggs or sperm, and adoption. So there's lots of different options for reproduction if that is something that people are interested in talking about. And we offer input on all of these things and can refer on for pre-implantation genetic diagnosis to our colleagues at Guy's Hospital, and gamete donation. And gamete donation is just egg and sperm donation. And these are our two lovely geneticists, both consultant geneticists, Ariana on the left and Shireen on the right. And they are happy to see anyone anytime, and we do video clinics. We also have a big team of neurologists, and this is for medical assessments. Now, to be honest, lots of people come along and don't want to have an examination. So the examination is completely optional. So you don't have to have an examination. You can just come along and talk to the neurologists. But if you did want an examination, we often do assessments of walking, balance, and so on. Now, the medical assessment, for example, if you are in a study like Enroll, can sometimes do some thinking tests. We always ask about psychiatric symptoms like depression and anxiety, apathy, irritability. And this is not so relevant if you're a young person who's well, but if you're a young person affected by Huntington's disease, non-neurological symptoms such as weight loss and swallowing and social difficulties and problems are always discussed. This is very much tailored to the individual coming for the appointment, and we offer a lot of support. And we also offer non-pharmacological therapies, which are very important. We offer speech and language, dietitian appointments, neurophysiotherapy, and occupational therapy. And so one of the things that lots of people want to ask about is updated news about research. And we can have long discussions about trials, research. The sources and everything that we present is always reliable. We always have one-to-one discussions about trials and about potential disease-modifying therapies and about studies that you may want to get involved in. We're very involved in trying to develop newer symptomatic therapies. We have a big program of research into trying to develop biomarkers that are more patient-friendly, that don't involve having to always come to the clinic, and Lauren Byrne is very involved in that. We do a lot of research on trying to understand the mechanisms of disease, and that's important because it's all about developing therapies once you understand all the mechanisms. And we're interested in understanding more about how the disease affects people. And these are our neurology consultants. There's myself, Peter, Marianne, Ed Wild, Tom Warner, and Thomas and Andrews. And you can choose to see whoever you want. We also have some wonderful clinical fellows, so they're neurologists in training, and there's Yara, Mike, Carlos, and Mitsuko, and they are all involved in research and clinical trials, and they're a wonderful team. We have a really good and very supportive team of specialist nurses who are often the first point of call. Here is Desiree, here up on the left, Daniela Ray, who's our nurse consultant, and Cara, who's also our nurse specialist. And Desiree, Daniela, and Cara really lead the team with holding the whole service together. We also have really extensive psychiatric support. They have decades of experience in Huntington's, and they can look after people before and after symptom onset, managing depression, anxiety, irritability, apathy, any worries about psychosis, obsessive compulsive symptoms, and they offer both pharmacological and non-pharmacological. So that's medical and non-medical. And we also offer psychological support through the nurse support service. We can give advice about the nature of the disease. We offer a counselling service, and we work closely and coordinate with local specialists as needed. These are our two neuropsychiatry consultants, Nadim here on the left and Vishal. They're wonderful, very kind, and very supportive. We work closely with the HD Association through local meetings. The HDA support in our clinic allows sometimes we have a team of people who come to our clinic and also often join clinic appointments. They can help offer talking to other patients, talking to other young people, for example, through HDO. They give advice in our service on insurance and legal matters. They also provide emotional support. They have extensive knowledge about local resources and very much about living well. Here are the team who work with us of the HDA advisors. There's Rachel, Anna, Helen, who introduced the talk today, Tracy and Dawn. And they're a wonderful team that we work with. As I mentioned, there's the opportunity to get involved in any sort of research. We run observational studies like Enroll. We're doing a lot of studies where we're trying to understand more about how Huntington's affects people. A lot of that work is done in people before symptom onset, but we also have studies where we study people after symptom onset. And a research assessment may involve thinking tests or motor examination. They may involve taking blood samples, and there's a picture of a urine pot here, but we don't often take urine. We did collect a lot of urine, and in the end, we found that urine wasn't so helpful. I actually have a fridge full of urine that we collected, but mostly it's blood. And we have digital biomarkers, which Ed Wild has been working on, where we have smartphones and watches, where we try and monitor daily activity. And we do a lot of scans to try and find out what's going on in the brain. So there's MRI scans. And also we do lumbar punctures here, where we're collecting cerebrospinal fluid to try and find out what's going on in the brain. And so and all of this links to clinical trials. We are running and will be setting up many different clinical trials. There is the Roche program, the triplet therapeutics program with an MSH3 antisense oligonucleotide, the Unicure gene therapy study, the Novartis small molecule splicing agent, which is coming online, and PTC therapeutics, which is coming online. And we have previous trials that we ran are Teva and Pfizer. So we have a huge clinical trials team and the opportunity to get involved in clinical trials. And in the future, we will be running clinical trials for people who carry the gene but don't yet have symptoms, and being part of a clinical service so you can be on the database for these future trials, I think is important. This is the clinic research team and Enroll team. We have Sophie here, Kate and Fiona, and they are able to do assessments in clinic and also happy to be involved and ask any questions. And they're a really good team who, Sophie, Kate and Fiona, are very, very kind. So what do you need if you want to come to our service? So we can do virtual video clinic appointments. Because of the way the NHS works, we can only take GP referrals, but we accept GP referrals from all over the UK. Doesn't matter where you live, we just need a GP referral. It's through an e-referral system, which is directed to my team, and it's NHNN Huntington's disease. And it's through an electronic referral system, which all GPs use now. And I just want to give a summary of what I've talked about. We have a comprehensive team of people who are able to do assessments, but also you may not want to have an assessment. You may just want to come along to the clinic. We have a multidisciplinary team, and I showed you all the photos and individuals. We can offer genetic counselling, supported information, see at-risk or gene carriers, and we can also see people who've tested negative who may just want to come and talk about things. We have a service email here, and if you have any difficulties getting referrals, you can email that email address, and the team can advise you on how to get a referral. We can take referrals from all over the country through the ERS e-referral system. So it's just electronic referral system. And this talk has been recorded. It's going to be on the HDA website. And I'd like to thank you for listening. This is the HD Centre team, and I'm happy to take any questions.
Thank you, Sarah. I think it's really great to hear what, for those who maybe haven't got access to local services, what they might be able to access now. And I'm sure it will be useful for people to hear. As I mentioned at the beginning, this is one of two webinars. We've got the second one happening on the 10th of March. And we've also got an event for young adults on the 10th of March, looking at PGD that Sarah mentioned. So if you're interested in either of those, then have a look at our events page. And we've also got quite a few webinars coming up. Some are being advertised on the events page at the moment, and some will be advertised shortly. Also, just to mention, as Ruth popped in the chat, if someone's interested and wants to know more but doesn't want to ask a question this evening, then you're very welcome to contact the HDA. There is one question, Sarah. What age group covers young adults? So when you're talking about young adults.
So it's really, anyone can be referred to our clinics. It isn't really an age cutoff. So we see people in the clinic. I see children sadly affected by Huntington's disease, and we see people right up into their 80s. So there's no age cutoff. What I think of a young adults is kind of age 16 to about 40. Because that's the kind of, from 40 upwards, you're kind of getting more into middle age. However, if you're 45, it doesn't matter. Anyone can be referred to our service. So the talk was aimed at people who may not be under regular follow-up in any form, but basically it can really cover anyone. We're not qualified to see children other than children that are affected by Huntington's disease, and that's always done with pediatricians, but anyone above the age of 16 is a young adult. So but as I say, if you're older than 40, you still can get referred. It's not there's no age cutoff.
And I guess the key thing is whether those are the issues that are relevant for you that you need help with, aren't they?
Absolutely, that's exactly right, Helen.
And the next question is, are there support groups face-to-face or online for those tested negative but family that are positive?
So if you tested negative and want to actually just come and talk or have some psychological support, we can take referrals. But I'll let Helen answer about face-to-face or online support groups.
So just to mention, we do have a closed Facebook group called Kim's Friends that you can access, which is for those who have tested negative. And we have added some information recently on our website a page for people who've tested negative. So if you have a look there, then it should give you details, or if not, if you need anything more, please get in touch and we can direct you. And then Sarah, another question: what's the best avenue to go down to get counselling if you're HD positive?
So what if you wanted to get referred for that, what you would do is you'd ask for a GP referral and say that you would like counselling and talk about being HD positive, and then you would be seen by one of our nurses who run more psychological support. And if you needed more than that, we obviously have the psychiatric team, but we do psychological support in the clinic, and we also have contacts with all the local services as needed from all over the country we can access, so you can get psychological support where you live locally, because we work closely with the HD Association. We link in with local services who can then continue with ongoing psychological support. So basically we're a bit like a hub and spoke of a bicycle wheel. And so you can come and see us. We can talk about accessing counselling. You'll get some counselling support, but then we work with your GP and your local services to get you counselling support where you live. So that's how we work. So if to access it, you'd need a GP referral to the clinic.
Thank you. And then another question. So just from someone saying the team has really grown since they first visited, asking how many people you see virtually, but just commenting as well, this makes a huge difference to accessing the team for those who might struggle to go to London, and asking whether they can share that at branch level, so locally to them. So
it's a very good question, and that's the reason we did this. I did this webinar, because one thing that came out of the pandemic is we developed a completely virtual service. So with our clinics, half of the clinics are face-to-face and half are virtual now. So 2 clinics a month are virtual, and 2 clinics a month are face-to-face. So we see, if we see 100 people a month, we see 50 virtually, because lots and lots of people prefer virtual appointments. So we have a fully virtual service now, and it's all through a video link, and we're very much set up for a virtual service. So we can look after people completely via video. You never have to travel to London. And that's one of the really good things that have come out, is that we now have a virtual service. So we can see anyone from anywhere in the country via our virtual service. So it's done half and half.
And I guess the answer about sharing it at branch level is absolutely, you can share
absolutely.
it,
please
locally,
do.
and hopefully can share the recording as well at a later date. Brilliant. And then what's the best way to put yourself forward for clinical trials if you've had a positive result?
So that's a good question. So if you've had a positive result, there will be clinical trials for people who carry the gene, but don't yet have symptoms, and they are going to be starting. The PTC one is starting for that group, but there will be lots over the next 2 to 3 years. And this is also important, and why I wanted to do this webinar. So to be put forward for clinical trials if you carry the gene, is the best thing to do is to get a GP referral to the service, and we then recruit you to the enroll study if you want. And then it means, or if you don't want to do enroll, we put you on our research database. And then when a clinical trial comes up that is suitable for people who carry the gene but don't have symptoms, we go through our research database and say, well, actually, that person fits what's needed for this clinical trial, we'll contact them. And so basically you go on a research database. Now, we can't put people, we're not able to put people on the research database without them being part of the service. And the reason for that is because we want to provide the best care. So you can be part of a clinical trial and never be seen in clinic, but we do need the referral for you to be able to access the research, as it were. So if you want to be put forward for clinical trials, but you don't want to be doing anything like coming to clinic, you just have a single one-off appointment, go on our research database, and then when a study comes up that you are suitable for, we get in contact and let you know about it. So that's the best way.
Thank you, Sarah, and thank you everyone for all those questions. I think
great questions, really important questions.
Brilliant questions, and I think that's all that I can see at the moment. So unless anyone's got a last-minute question, it just leaves me to say thank you to Sarah for joining us, and thank you to everyone who's joined this evening as well.
And thank you for joining, and please share the video and with your local branches and local services and friends and family, and we're here to help.